please know that you are not the problem. That angry, very tired, very stressed nurse is not the problem. The problem is the problem.
Hello, everyone, and welcome to the Strategy of Health podcast from the American Journal of Healthcare Strategy with Cole, myself, of course, joined today by a very experienced individual with unique perspectives who's doing really important work, a 21-year veteran of the military, and is now, of course, working in the federal pharmaceutical space, Justin Cauthen. Justin, please tell us how you're doing this evening.
Hi, how are you, Cole? I'm doing good. Thank you so much for having me on. This is actually my second time I've had the honor of being on here, and it's really exciting to come back and kind of talk a part two, but also a more military-centric side of my experiences.
Yeah. It's so funny. I had so little interaction with anybody who'd been in the military until I started doing the podcast, and then I got introduced to a few individuals early on who were doing administrative fellowships after getting out of the military. And I'm like, wow, this is such a different type of experience that is like not discussed seriously enough or loudly enough when it comes to business and operations. And then of course, then we connected there and you were on Zach's show with focus towards clinicians. And then now, of course, this show has the executive audience. And so that's different, but we do really appreciate your time and thank you for coming on. And I have to ask, there have been some changes since we last talked. What is new with you? What? Tell me about the transition.
So I could do a whole podcast series on just this, but the transition from the military is unlike anything else. We do a good job in the military helping people prepare, giving opportunities. I joined the military at 17 and I finished a master's, graduated cum laude, but that was all through online school and night school. Got a chance to earn a whole bunch of different certificates. And from a resume standpoint, I was very ready to transition, but the culture is so strange, not just in the sense of what to wear. And I had an existential crisis on whether I should or should not grow a beard, right? Yours looks amazing, by the way.
Oh, thank you.
But then also, but more so things of how do I translate certain experiences? I can go into it a little bit later, but I helped run the COVID response for an entire country. How do you really explain that on an 8.5 by 11 sheet of paper, 12 font, double spaced with only 2 pages, right? You can't really talk about that. And it's also hard to what to focus on. I have a whole lot of badges and ribbons from some cool guy courses that I went to. And that's hard from a cultural standpoint to kind of deprogram me that those things don't matter aren't as important, right? It's hard to say, it's hard to tell me, you're telling me jumping out of airplanes isn't important to a healthcare executive clinical space. Like they don't want that in a C-suite. Come on now. And so there is a challenge and change. And we can't understate that enough. Also, the anxiety of choice is actually a lot more overwhelming than you think. I have overdressed and underdressed for so many different types of meetings because it's just hard to kind of read what the expectation is. In the military too, and we all follow a very specific career path where there's expectations of do this part of your job, and then you need to come to a hospital, then you need to go back to a field unit, then you all need to get the same degree from the same place. Then you need to get a chance to have leadership in this position with this amount of people. So you just kind of follow behind your mentor and kind of copy and paste, rinse and repeat. And coming to the civilian world, when someone asks you, what do you want to do when you grow up? That's actually a very challenging question. And I felt very bad when I just said, I want to make money, because I didn't really know how to equate it because I always had this very set path, right? So one thing I've learned is that there is an abundance of mentors. I got on LinkedIn and all I did is I just started putting out connections of, I don't even know what I don't know at this point. Please help me. And there's executives and they were so sweet and so wonderful. And they said, well, I know nothing about the military, but let's see what we can do for you. But the hard part for me was actually asking for what I needed. I never knew how to actually ask, I want this opportunity or I need this. We've been programmed over decades of service to wait until it comes and then execute in that moment.
That's so much. I feel like what you're saying is very correct. You could definitely have a whole episode, probably a whole book. I hope you do write books eventually. Um, it's inspiring to hear. I have questions though. When you talk about culture and you talk about finding fit, um, a lot of people from the military go in to be consultants, and it makes a lot of sense. Of course, you have all this expertise and this experience that's pooled, and it makes a lot of sense. But you did not really go into consulting. You're not at McKinsey or Deloitte. Deloitte hires a ton of veterans. So, tell me a little bit about how did you actually find this, and I guess in kind of a way, answer the question of how did you learn to ask for what you needed to get to where you are now?
Thank you. So I think one thing that a lot of people, both executives, any type of leader in a C-suite, someone that's really committed to an organization, they are drinking the proverbial Kool-Aid at that position, right? They eat, sleep, and breathe. If they're good at their job, everything within that organization. So one, we're not very good at saying, is there some other track or organization or opportunity that could do better things for me? And two, the really hard question is, what do I want? I think sometimes we're so married to, I'm doing great in this field. We don't allow ourselves to think, but what if I had passion for it as well? I have found in my very brief stint as being a civilian, if you show passion for something, someone will come within opportunity. You have to be ready for it and also have an open mind that it's not going to be this perfect, exact picture, right? We kind of underestimate our abilities as human beings and as first world citizens, frankly, to enjoy what we find ourselves in as opposed to finding ourselves in the places that we can optimally enjoy. I walked around a hospital that I worked at as the chief clinical sergeant major, and it was very easy from the outside looking in to see those people who loved what they did every day, and other people that were married to this. I'm in federal service. I have 2 more years. I just have to survive it out. I didn't just see it in their demeanor. I saw it when I found out about challenges they were having at home. I saw it in their healthcare. I saw it in their productivity, and I saw it in the dangers or successes that they brought to the hospital. There's some people that seem to be healthcare providers by choice in our facilities, and some that are there for predictability and reliability and a good paycheck and safety. And when you chain yourself to those things, from the C-suite perspective, we see productivity, we see safety hemorrhage very quickly. Yep. I would argue that almost every single Joint Commission major finding goes back to a single unhappy person.
I could agree with that. I could actually very much agree with that. It's funny, not to bring up AI out of the blue, but we were talking, my wife and I, about what a really good scenario for AI would be. And, we're discussing, does it mean no job loss? It's like, no, it actually does mean substantial job loss, because actually you'd want the people who are in jobs they don't like to leave those jobs and find something they're passionate about and be empowered. And I was thinking about that within healthcare, and you just said the scenario I see very perfectly, which is people face all these pressures to be employed for different reasons. Physicians bring home a reasonable salary, but they also have student debt. A lot of them have families and extended family that they care for. And so they might be trapped into this kind of field in a way. And I know a lot of people might say, well, that's crazy because they make $200,000 a year plus or whatnot is usually the starting. But you don't always see kind of the world from their point of view. You're not in that situation. Have you found that difficult at all when it comes to relating to the advice of those mentors who weren't in the military, is because they don't really see it from your lens?
No, because I have found a good mentor is as stressed about being a good mentor as the mentee is about what they're trying to learn and grow from. I had 5 core people that really helped me transition from the military, and I put in 1,700 resume applications. Ironically, I got 3 amazing job offers, and they all came from people who had a relationship established with me via social media, actually.
Wow.
Once again, that 8.5 by 11 sheet of paper, it's hard, really hard to capture the stuff that C-suites really value, right? I can show all these amazing things that I've accomplished, and at that level, we've all accomplished things. We're all go-getters. We're all people that get it done.
Yeah.
But at that level, the how we get it done matters a lot. It really, really does. The heavy-handed leader that is going to ensure that the bottom line is met, that bed occupancy is going to be at 95% plus or minus 1% at all times, that near misses are going to be no more than 1 incident per 80 working hours, right? Those people, and then where they have to throw people to the side for those metrics. Gen Z is not going to tolerate them. The nurses coming in right now, the individuals that are in med school right now, the techs, the housekeeping personnel, your security guards, they're not going to tolerate that anymore. And those skills, we still don't have a really good way of putting those on resumes, but those skills are not easily, one, they're mandatory for C-suite members now, but two, we're having a hard time identifying those. And to your point of AI, AI does a very good job of powering through resumes and selection processes. We haven't taught it how to look for those things yet because we ourselves don't really know what we're looking for. We look through it or we learn from it through our experiences. We never knew like, oh, I know this guy is going to be the nicest, most understanding, most empathetic, most responsive leader based off a resume. We have to experience that after he or she's been in the organization for a year or two. We always refer to it in the past, not of their potential for that.
So I firstly, I appreciate what you say about kind of that mutual stress and that mutual eagerness in a way. I think that's really important and that makes a ton of sense. But that also has me ask the question of what can we do aside from what we're already doing when it comes to adopting new leaders or hiring new leaders, where we look for their performance after a given amount of time, or we usually, in a lot of cases with leadership, right, you only hire if you've had them as a leader before or worked with them or seen some of their, that's how most leaders are now hired from statistics, it looks like. So what's the alternative to that you have found? How do you actually showcase your leadership, and how, as a hiring manager, do you tell somebody's leadership without actually working alongside them? Is that possible at all, in your opinion?
So one thing we've done in the military that I've been very proud of, and I try to continue to do now, is as a non-commissioned officer, as a sergeant, essentially, our scope for ensuring that our soldiers and our DHA civilians that worked for us as well was anyone within the United States military is ultimately our responsibility. While we do have individuals assigned to us, if we see an opportunity to improve, correct, assess, or potentially bring light, negative or positive, to a situation or a group, we need to do that. And what that does is it goes from us having one leader and one leader only to all the leaders in the military at our disposal. And you would think in a place like the military that there'd be egos of, why are you getting into my proverbial lane? We seldom have that, especially at the senior ranks. We appreciate you being there when we couldn't, because at the end of the day, I'm one person with 3,300 people across 26 different buildings at 4 different installations in 2 different states. I can't be everywhere at once. So you coming in and ensuring that you don't completely change policies that I put in place as their actual individual leaders or responsibility holders. But if you correct things, that's amazing. That's amazing for the organization as a strategic whole, but also as the individual, because I mean, in this virtual space that we're in, it's easy to feel like you're on an island. And when you're on an island for long enough, you start to feel like there's no one there to correct you, or even more scary, mentor, protect you, right?
So everybody's a leader is what you're saying, in a way, is the solution.
1,000%. I think about a housekeeping staff that I had that this individual probably saved more lives than any doctor or PA or NP that we had. Identified something that could have become a major source of infection and fixed it. Did it as a janitor. The truth is that anyone in an organization is capable of having an amazing idea and is capable of fixing all the problems in your organization. There's someone right now that can fix all the challenges that you have.
Yep.
Either they haven't felt empowered to speak up, or we have stopped them from speaking up in the past. I promise you, anytime I had a soldier that started to speak up, and I would say, you're just a private or you're just a young lieutenant, if you need an opinion, I'll give it to you. That's the last time they speak up for the benefit of the organization.
Yep.
It's really important to understand that everyone is capable, just as capable, if not more capable than you are, of leading the organization. And it's not because they have as much training as you or much experience or they've gone to the same schools. It's because they have a better down and in perspective of the organization. I see this across C-suites everywhere, in the military and out, is the pressure of, are we looking up and out, advocating for the organization at a higher level, or how invasive and down and in are we getting? I was blessed to be basically the junior C-suite member, but it was my job to really be the eyes and ears of the organization. I had an opportunity at a brick and mortar facility where I was in my office for maybe an hour a day, probably less. I had a little rolling desk laptop that I'd be able to go to, and I could stay in the ICU for a little while and continue my work. It's a laptop with Wi-Fi. It can do that.
Yeah.
But at the same time, I got an amazing amount of perspective for the benefit of the organization that we wouldn't have had without that. In the military, we say you get what you inspect, not what you expect from the organization. What that means at a very base level is you have to see it for yourself to really assess and understand it. But two, what it really shows is your subordinate leaders sometimes feel, and that's our mistake as well, that it's their responsibility to tell us what we want to hear, not what we need to hear. But when you go down there, one, you show that I'm going to see it for myself and I'm going to see what I need to see or what I have to see, not what I want to see. But two, I'm not living in some ivory tower. I'm not better than you. I just so happen to have a different job. I talked a little bit about this in another podcast about it's easy to demonize the C-suite. And sometimes we do it to ourselves when we live in this proverbial ivory tower, isolated from everyone with 3 badge accesses deep to get into. But their med-surg floor is open all the time. The urology clinic is open all the time. The pharmacy is open all the time. And if you just go there, even if you just do something as simple as you rotate where you meet with your chiefs or your directors from clinic to clinic, so other directors can know what goes on in the inpatient psychology unit or what goes on in the family practice clinic, it gets you out there. I have seen, and my leaders have seen more things that are, why is that up on the board? That's a 3-year-old project that we haven't been doing since then. Yep. And the truth is when you are in your area, you get very used to those things. And we provide a set of fresh eyes, one, by going around there. But two, we have a better understanding of standardization. I can very easily say that I worked for a 3,300 person organization, and our lizard brains immediately snap to everyone is working as hard as everyone else. Everyone is just as productive. Everyone is just as happy. We defy them to numbers. And that's a normal thing. And I'm not saying that you're unhuman for doing that. But we also don't see that, like I talked about before, some people are very happy. The morale in the OBGYN clinic is horrible right now. Mm-hmm. Why are the numbers doing so great in med-surg number 4 as opposed to 1, 2, and 3? We don't ask these questions. We just devolve to, they just work harder. Well, maybe it's because there's been construction in a bathroom for the past 5 months and no one's put any administrative pressure behind that or moved money from one bag to another to be able to get that done so they can have a reasonable bathroom break as opposed to have to walk an extra 1.5 miles a day because nurses don't walk enough as it is, right?
one issue, and it's not an issue because I agree with what you've said. I love what you said. You and me are actually very aligned. I think, I work at Penn now. It's a high reliability organization. Kevin Mahoney is very clear. He likes to talk to every single employee from, the lowest paid to the absolute highest paid, and make it clear that they are both equally contributing to the organization in really important ways, right? And that whether you're part-time or you're full-time, it's important. And I've spoken with him about this. But here's the thing. I guess one of the big issues that I have is Penn has 7 hospitals. It's easier to do that with 7 hospitals, right? You're talking about 45 hospitals or 50 hospitals. And I'm going to explain why I'm asking you this situation specifically. You're a CEO of 45 hospitals. It's hard to do what you just described at that level. However, the military is overseen by the president, technically, right? I mean, that's the commander in chief of everything. Mm-hmm. And what the military carries out is essentially for the benefit of the American people. And so in a way, it's flowing down an even bigger pipeline, and the military is even bigger than hospitals. So there's this argument that hospitals just shouldn't be that big. But then at the same time, there are examples of institutions that do work tremendously well, despite even a larger size. And so my question is, can you explain how we should take those lessons on that big scale?
Yeah. So I think one thing the military has going for it, and the U.S. Army is a 1.5 million person organization when you include the National Guard, reserves, and supporting civilians. It's not small. But I will say, and not to sound cheesy or like a recruiter, wherever I went, wherever I changed duty stations, or if I went to another base for a class, I still felt like these are my people. I'm with a community. I can go up and talk to anyone. If they're wearing green, I can talk to them because they speak my language. What the military has going for it that some of these super hospital systems don't have is long-term identity. I know that if I don't like it here, don't worry. In 2 years, my leaders are going to change. I'm going to move units. There's another opportunity. Do I want to go from being a combat medic to a flight medic? I can do that. Do I want to completely change and become a PA? I can do that. Do I want to take another route and go to Intel, something outside of medical? The opportunities are there. We're not Fort Sam Houston versus where I live now, Fort Carson versus Fort Drum. We are the United States Army. You just happen to be at this place for now. Sometimes the duty stations are really good, like Fort Carson, Colorado, where it's a 1 million person city and I see beautiful Pikes Peak out my window. And then sometimes they're a little bit rougher and I will leave those bases alone. But at the end of the day, when those people come here or when I go there, I am still with my people. And it's that cultural identity that, one, I really miss from, and I struggle with transitioning out of, and every soldier, Navy, sailor, Marine, Airman, Coast Guardsman, and now Guardian will miss. But two, I think the civilian world can learn a lot from that.
Oh, yeah.
I think a lot of people can go to whatever insert hospital and they're there and they say, I am stuck here. But what if we gave HR a more strategic level capability of saying, are you willing to move and recommit your time with us? How do you like St. Louis? We can get you closer to your family in Las Vegas. Would you like to go up to upstate New York where your in-laws are at? I have an opportunity there. And I think we'd see a lot less of, I see on LinkedIn all the time, 2 years at this hospital system, 2 years at this hospital system, 2 years at this hospital system, because that's the only way they're able to move up. So in some ways, the bigger the hospital system, the better. But if and only if we have a really good HR administrative capability to be able to foreshadow and move people around. And then in many ways, you can really standardize your executive or your administrative staff as well, because the administrative staff, probably more than anything, the adventures change with every single person. Some people have some planning, some people have some strategy, some people have some finance, some people have some business. It's where the opportunities are. But if we were able to build big monster hospital systems, we take people out of college, they immediately go into a very small group practice position. Then they get to go to strategy as a junior person in the pit. Then they get to go to finance. Then they take a larger clinic and then they go to a larger finance system, and then they go back to leading again. You can have some very three-dimensional and some very predictable well, leadership in the future.
I have an issue with that though, because there are systems with these perfect ingredients, and I'm gonna kind of I love Atrium and Advocate. I love
Yeah.
their leadership. I know a lot of their leadership. However, they have hospital, they have university,
Mhm.
medical, and teaching, and so this is all very new.
Yeah.
They're doing very good with it, considering it being new. But one of the things that doesn't seem to have been eliminated, no matter how good the consultants are, no matter how big or small, is the speed of acquisition seems to really be the determining factor when it comes to how good the new staff feel about the new organization. And what I mean is, Jefferson and Abington, right? When Jefferson acquired Abington, there are people at Abington still now, 10, 20 years later, who are upset about that. And it has to do a lot with the speed and everything. Is there a way to overcome that once you've already made the mistake? Once you already have people who are mad at you because you botched, an acquisition, is there a way to fix that?
So I find, and I've been through some rough situations. 1 year deployed, 1 year home. 1 year in combat, 1 year home. And that 1 year, you're not really seeing your family the whole time because you have a 6 month training process. You got to go to schools for whatever rank you're at now, any other opportunities you want to pursue. So I saw my family 3 or 4 months every 2 years, truthfully, having real meaningful time with them.
Mm.
But we had very good re-enlistment rates. We had high retention rates of people coming in. And in the federal healthcare space, my facility had a 97% retention rate
Wow.
compared to the civilian hospital side of 41%.
Yeah.
Meaning that in the next day, I'm sorry, not the next day, in the next year, over half of your nursing staff will move to another facility. Over half of your doctor staff will be new. It's that is a wicked, wild turnaround rate.
Yep.
And I'd argue that the Army, especially in the early years of the global war on terror, really went through a lot. And the way they really navigated that was extreme predictability and extreme transparency. We have a thing called FRG, Family Readiness Group in the United States Army, where families come in and they would see the training calendar for a year. Hey, families, we just got back. You're about to go on leave for 2 weeks. But over the next 365 days, we have 280 days of training. Your spouse will be gone this month, and maybe this month. I might have to slide it left or right if it's okay. I'll put that out on an email. We are projected to deploy again roughly on this date, plus or minus 90 days. Please make sure that we don't share that because this is sensitive information. This is for our families only. But this is what you know, and this is what to expect from where your soldier is going to be. What I promise you is your soldier will have a minimum of 6 weeks over the next year as opportunities to take leave. Mm-hmm. But what I also promise you is your soldier will be gone for another year in combat by this date. Yeah. That level of transparency and just blunt of like, this is rough, but this is the job and this is the life. Yep. Is life-changing. We had some units that had over 50% divorce rates. Yep. And a very, very high suicide rate because they did not do that. And we had some units that had very extreme training processes and very challenging deployments and deployment experiences that had 92% marriage retention rates, which is about 42% higher. I'm sorry, 23% higher than the peacetime military average in the middle of a war when we didn't know when this was going to end. So I would argue, what's stopping our C-suites from saying this is the transition process? Things can always change. This is where we're at. These are the challenges. This is my work schedule. This is how many hours I work. This is where I will be today. I'll be physically at your clinic on this day. I look forward to seeing you all. I'll be handing out some awards, some Daisy Awards to our nurses. And then I will be having another meeting with your team on this day. We're going to lose 5 more of your staff within the next 90 days, and I'm not going to be able to hire them back for 120 days past that. Currently, I'm not allowed to lower your amount of surgeries that they're simply not letting me. So you're going to be expected to do more with what you have for the time being. What I ask from you is you continue to give safe, quality care, and if you cannot do that, you do not do the care. Yep. And then you let me know. Wow. It's never a fun message, but that transparency is a lot better than, well, they're going to find out when it happens. That's when the anger comes from my experience.
I agree, but the thing is that I have to ask, and maybe this will be one of the last questions. I don't want to keep you too long, but I keep going down this path, and the issue with that is it's so simple. It feels like it's sending an email out, or it's paying somebody. You know, you have to pay an expert $200,000 a year to write emails for you, when you're spending tens of millions on bonuses for nurses and MAs, starting bonuses when they start, to try to attract them in these competitive talent pools. Tens of millions of dollars are spent on these bonuses of people who we're already funding the education for, right? A lot of time. We're not funding, but we are trying to fund the programs to increase the education. So we should already have a pipeline. We're having to recruit externally. And so it feels like if it was as simple as sending just an email, right, people would have already done it. So why is there this like such a insurmountable mountain, it feels like, to overcome to get good communication?
So one, those conversations cannot be email. We have to leave Outlook leadership on the computer, and we have to be where the needles meet the arms. We have to physically be there. And sometimes we have to take the awkward, painful looks on people's faces. Us in the C-suite enjoy a very sterile experience. It is our subordinate leaders who every day are taking those proverbial face punches for the decisions we make. And I would argue that it is worth, instead of that $10 million that we're spending a year on bonuses, you pay or your organization pays the $350 for a flight and another $80 a night at a Motel 6 for you to go there and you to speak to them about it directly. Instead of spending money on someone to write a good email, how about have someone help you get a really good PowerPoint presentation together to show? And you get, we start enabling our administrators on how to be good public speakers and how to be good negotiators and get those skills so that we can listen to and actually apply what people are saying. And once we start doing that, then we're going to capture the real things that are causing people to leave. I don't think it's pay. I don't think it's long hours. They knew what they signed up for. They're doing a sacred job. I think it is simply temperature. And if we're able to change that, like the organization that I work at right now, I would have to get paid triple to leave. I love my leaders there are so great. I would have to get paid 3 times more to consider moving. And that is the power of a hyper communicative, hyper honest organization.
That's one of the biggest things I've really enjoyed since starting at Penn is 2 or 3 news blasts are coming to my email a day. My manager actually is talking to me in the morning and in the evening every single day, right? It's not, months between manager communications. We know what's happening at the corporate level. I think that that's just it. You do feel so much more integrated in what's happening when you have that communication. I have to, and I do hope that people listen to this and adopt to it. Why don't they? What is the struggle, do you think, that people face internally, and how can they overcome that?
I think the struggle that people from the C-suite have is the constant beatdown. It's it's an emotional soul suck, having to choose between the money and the staff, or between the patient and the staff. And they feel like they have to. But the good news is about having world-class nurses and world-class doctors is they only have to choose the patient. So that means you get to, if you do it right, you get to choose the staff. Advocate for your people who will advocate for their people. And when they need something for the benefit of them, they will come to you. And I think if it works more like a circle versus a tug of war, this symbiotic relationship, not to sound cheesy, but honestly, this circle is what it was meant to be. Money has to get made, money has to get paid, and resources have to be preserved and safeguarded. But we can do that while at the same time not succumbing to the patient to the detriment of our people. And we can also ensure that our people are doing the right thing without the detriment to ourselves, to our budgets, and to our patients.
Wow, what a beautiful place to end on. And I actually thank you, because I always refer to it as a tug of war. But they always think I'm talking about adversarial, and it is adversarial in some ways, but it's supposed to be symbiotic, like a circle. So what a perfect illustration. And so that's awesome. Yeah.
Can I add something to that really quick?
Please.
If you come in and do this, you will be met with a lot of hesitancy, and rightfully so, from your staffs. There's nothing worse than going up to a med surg floor. It's like, hi, I'm from the C-suite. I'm here to help you fix all your problems, right? But as you say, what do you need for the benefit of your patients? You have to understand that you're going to be met with a lot of frustration.
Yep.
But please know that you are not the problem. That angry, very tired, very stressed nurse is not the problem. The problem is the problem. You in the C-suite have special training to be able to help build communication, teamwork, relations, and efforts towards the benefit of that. Please remind them of that in a very healthy way. And please, if you do nothing else today, go to one of your clinics and thank them for what they're doing.
Yes.
They don't get paid enough. They never will. They're smarter than us. They are harder working than us. They are more tired than us. And they deserve our respect. And you deserve to tell them that. And you deserve to feel like they respect you. And the only way to do that, though, is for you to start with saying, Dr. So-and-so, I can't imagine what you do for your patients every day. You're doing God's work. I'm so impressed by what you do. Housekeeper so-and-so, your staff has prevented more infectious diseases in this hospital than anyone else. You're here at 2 a.m. when I'm at home safe and sound. And I know that if I have to go into my ER, it will be clean and sterile because of you. Thank you so much for what you do.
I think people should think about too. I love that so much, because when they say that to the doctor, there's always this hope that the doctor will say it to their nurses. The nurse, it creates a better environment, and it just takes somebody starting that. That is so beautiful. We're going to cut that into a short clip as well, I think, and send that out there to everyone, because that is really beautiful. Yeah. Thank you, Justin, for coming on.
Cool. It's been my honor. Thank you so much.